such great joy to be able to affect who they are. And that's why it's so important, because you are helping to shape them.
Hi, I'm Natasha Gillis, and here's a little secret. One of my favorite things to do is drive around town and proudly point out each dental practice my firm has helped grow. Because behind every practice is a real story of grit, vision, and entrepreneurship. On this podcast, you'll hear those real stories straight from the dentists who dared to build something of their own. So tune in, get inspired, and remember, your practice is my passion. I am here today with Dr. Lynda Duru and Krystle Duru, a mom and daughter phenomenal team. Very unique and rare. Thank you guys for coming.
It's a pleasure.
It's a pleasure to be here. Thank you.
So I'm going to call you guys Doctors Duru. So you don't know who I'm talking to. You guys are amazing. So I love your office. The moment you walk in, you feel like this is a pediatric practice. You have your tree house, you have all the cool kitty stuff. So this is very exciting to be able to let our hair down and talk more informally about kids, and equal access to care is going to be our topic today. Before we dive into that, I want to hear about Mama Duru's background, because you have a very interesting story about dentistry and how that became your passion.
Oh, yeah, absolutely. I always knew I wanted to do this when I was 9 years old. I'm the first of 9 kids, 8 surviving, and one of my younger brothers had a toothache. And where I come from originally, we didn't really have toothache. We had malaria every week, and you had other things going on. So when he had this pain in his face, and we didn't know what it was, the pediatrician said, "It's not mumps," and said, "You go see a dentist." And we were like, "See a dentist? Are you kidding? For what?" Anyway, there were 2 dental offices in town. One was private, the other one was a state-owned dental practice. And the private one had gone out of town because it was around Easter time. And so the first time we went to the state-owned place, we couldn't be seen. We got there at 6 a.m., but that was done for the day, the quarter for the day. And so the next day we got there much sooner. But the best part about it was that my brother, who couldn't sleep unless he was on my back and we were walking back and forth on the balcony, when that tooth came out, he was like a different kid. Wow. And I already knew I wanted to do something in medicine. And I said to the doctor, "What do you do to be this kind of doctor?" And then she said, "Oh, it's hard. You do this." And I said, "I don't care. That's the kind of doctor I want to be." So that's how it started for me. And I've been on that path.
So how did we recruit little Duru? Even though she's not
Jedi mind tricks. No, I think it's one of those things where I'd always wanted to be in healthcare and work with kids. And so I had the, just being fortunate, being around my mom when she went to residency. And at the time, it wasn't even dentistry that I wanted to do. I wanted to be a pediatric surgeon. So she let me, her friend was a pediatric surgeon, and she allowed me to intern with him and just kind of watch some of the surgeries. And I was like, oh my God, this is so cool. But of course, growing up and seeing more and more the practice, working in the practice as a pediatric dental assistant at 16 as a teenager, I was like, this is pretty cool. This is actually more fun, and you find out all the things that go into being a surgeon, and then you find out just how impactful you can be being a pediatric dentist and how fun it was. It was a no-brainer after a while, where I was just like, this is a path. And then it's been a slow burn in love, meaning like I've just slowly through those years become to love it a lot, and know that I could still do surgery, still do have a lot of impact on pediatric patients, and still have a good time. So
it's interesting. When I talked to my kid's doctor a long time ago, you go through checkups and stuff. One of them was a pediatrician. She said, "Oh, we see little people. We don't do big people things." And I can't remember the conversation. It might have been a situation where they were sick and I was sick too, but I can't remember. And it was kind of cute because I was like, well, what about little people? What makes them so special? She goes, they don't have all the complications of big people. They're a lot more there's a heart and soul that it can't be explained. So
Yeah.
is that how you feel? Because pediatrics is kind of a unique thing.
Yeah, they're so pure. They're so pure. I tell you, I had one of them, he was 2 years old. Actually, it comes to my mind like because the mom brought his niece last week to their practice. And at 2 years old, this was almost 20 years ago, he would come to the practice and he would say, I want her. He'll point, and then he'll go to the toy basket and get a ring from there and give me a ring. So he'd tell his mom, that's mine.
So cute. Aww.
And sometimes I'll joke and say, I need a bigger diamond ring. And he'll be looking into the basket trying to find a bigger one, a bigger stuff. So they're so pure and so innocent. And there's no pretension about them. They tell you how they feel. You know when they're happy, you know when they're not. And it's such a great joy to be able to affect who they are. And that's why it's so important, because you are helping to shape them dentally, whole health, and otherwise. And sometimes you don't even know the influence you've had on them until they've grown. And, so yeah, it's amazing.
It's actually a different story for me. I love kids just because I agree with you and the impact, but
You didn't get a ring, did you?
I didn't get a ring, so. No, but all of my kids, all of my patients are amazing, and I feel an energy towards them. It's almost like they empower me. And then over time, because the practice has been around for over 20 years, you see patients grow up. 25 years this year. So you see patients grow up, become parents. And so you do see that impact. And you see patients who didn't get great experiences other places when they come, and you see how the parents are. And it's made me even more empathetic to parents. And adults, right? Because of that foundation that was never laid, and how important and pivotal it is to have good memories, good oral health, or just good health, and good information for them as kids. So seeing the adults gives me even more empathy, and just actually makes me feel like, okay, I still want to be a kid a little bit more, but it allows me to have a lot of empathy for parents, and makes me even want to continue working with kids much, much more. So, yeah.
So, true or false, parents who have good experiences with their own dental care are more inclined to have their kids comfortably come and feel more comfortable with the dentist. What do you think? Is that true or false?
So true.
Absolutely, yeah.
Absolutely. No doubts at all. No doubts. Mm-hmm.
So it's important.
Yeah.
It's extremely important. What we remember, it's really late. That foundation is completely laid. I mean, it's psychological too. We talk about the inner child. We talk about all types of things in psychology, and all of that happens or plays a role in what impacts you received when you were a child, and what kind of experiences. And that goes with school experience and medical experiences as well. And so the parents that don't get the good medical or dental experience, those are ones that you have to sit down a little bit more, talk to, and have them understand the impacts of their fears on their children and their children's health. Because sometimes when we talk about even just access, the awareness, right, the education, and then allaying those fears of what they had when they were children, it impacts how they make the decisions for the treatment plans and for their kids. So being able to just understand that and listen to that first, the kids actually are stronger. To me, they aren't just little people. They are resilient aliens that are amazing, right? And they are pure, right? It's until the world's influences and their parents' influences come into play. Before that, they are amazing individuals to learn from, and they're very resilient. It's the parents who then put the fears, and that's what I've understood and grown to know more about, and even listen to the parents and to see how they are. And then after a while, I'm like, okay, get away. I want to talk to my friend.
You can go wait outside. So you brought up a really good point too, is access. And, we're in a fairly affluent area in Northern Virginia. So for us, when we think of access to care, sometimes, and I think this is not a service that we maybe have in our brains, we think, they can afford it. And we kind of dismiss it. But it's not just about affordability, but also the willingness to feel that they can come and be heard. They can have a non-judgmental place. Even language, sometimes that becomes a barrier. What are you guys' thoughts on access to care, and how do you embody that in your practice?
Well, first we spend time to listen, because most of the people who come to a practice, we help them connect the dots, and they're going like, well, how come nobody's ever told me that? And we start asking stories from what happened when this baby was coming into the world, and because how that baby comes in impacts who they become. And the brain doesn't forget, and the brain doesn't like gaps either. So we spend time to listen, find out what they're going through, what they have tried, and what their goals are. And most times it helps them to feel calm and feel comfortable. A lot of times, a lot of them are crying just because it's the first time someone's ever put the story together for them and connected the dots for what their kids have been struggling with. Sometimes they've gone to places and they weren't believed, but your mama heart, your intuition is always going to be right. So we always validate them and go like, yeah, what you were feeling is right or was right, and this is why. And so once it starts to make sense, then it's easier for them, well, most of them. Some people get like, oh my God, it's my fault. And no, it's not your fault. It's not about fault. It's just what is. And once you understand what is, then there's something that can be done, then you're in a better place to accept that.
Yeah.
I like that perspective.
It's access to awareness, right? When it's not necessarily access to care, it's access to awareness and having that understanding that certain things that you may have thought weren't important actually are, and the dots are being connected. And they're not trendy, right? It's not just a trendy
it's not a
fad or anything like that. And so being able to help connect the dots allows a parent to have a better reach in their mind as far as what health is for them, and more integrative kind of advocacy that we can give for them.
So you guys do a lot of airway, right? Tell me a little bit about what prompted that specific focus, because we were talking about trends, and as a consumer or somebody on the other side, we hear a lot of dentists now, airway's a thing. And I always remind myself, no, it's actually part of, an integral part of your body. So share with me a little bit, especially with little ones.
Yeah.
Airway. I mean, how early does that start?
Well, that's a great question, and I think I would take it back to me again. I'm a recovering sleep apnea patient, and the way that I was diagnosed was a physician, the fifth one, by the way. I was treated for Lyme disease, which I didn't have. Took a look in my mouth and said, you must have sleep apnea. I was like, are you crazy? I'm a dentist. I would know if something in the mouth tells you that. And so she sent me for a test, and she was right. And I was CPAP dependent for about 7 years. Yes. And then it stopped working. So CPAP is a machine that just blows air in so you can get more oxygen as you sleep.
Rescue device.
Yeah, And so when it stopped working, the option I had was, then when the symptoms came back, the option I had was to have my jaws broken so they could make room for my tongue, because apparently my tongue was falling back into my airway when I was sleeping. Wow. That was one of the reasons I was stopping to breathe. And so I said, no, thank you. I'm not breaking my jaw. So in the process of looking for options for myself, I became more aware, and that how well your face grows determines how well you breathe and how well you sleep. Yes. And your face starts growing like very early on. And And from there, there were other therapies that I had gone through. Now I no longer I haven't had to use my CPAP for 3 years. I used to have migraines from like this little, and I haven't had a migraine in 3 years either. But the more critical part of it is that looking back on pictures of me at 9 months of age, all the signs were there.
Really?
I had the twisted neck, the twisted, clenched fist all the time. I was inconsolable as a baby, is what my mom said. And that became anxiety as I got older, and that became all those headaches and migraines and reflux, a lot of other things that I did not know were connected.
Yes.
And so understanding that, and we see babies as early as 2 days old that are having trouble nursing or breastfeeding. That's a function that a baby should just crawl out of the belly knowing and being able to do.
Yes.
So if they're not able to do that, then you'd have to start thinking, why? And so that why goes back to how well they formed or what happened as they were being made or as they were coming through the birth canal or even by C-section that made it difficult for them to nurse. And so, those start early, and the tongue is responsible for a lot of growth of our face. And if it doesn't function well, your face doesn't grow as well. And your airway is just at the back of your throat, right there, right behind your tongue. So if it doesn't function well, you don't grow your face very well. Your nose doesn't grow as well because the roof of your mouth is the floor of your nose. So all of that is all together.
Oof.
Yes.
That's complicated.
Yes.
And so, it's more than the airway and just the structure. It's the function. It's the behavior of how all of that works together. It's the nervous system, which innervates your tongue, the muscles, and all of that. So this is about 10 years of information that goes into that we have to squeeze into telling our patients each time, which is half the reason or a lot of the reason why they're like, how come nobody told me this? But a lot of it is, the information is out there, has been out there since the 1800s. Yeah. It's just that, things have changed as far as how we understand information. Yes. More research has come out. And then also, medicine was separate, including dentistry,
yes.
which is the beginning of everything.
Yes.
What we eat. It's a lot different, and we're eating a lot of mushier foods and things like that. So the pieces couldn't come together until you see an increase in chronic diseases and illnesses and getting worse and worse for children over time, as And so, so that's how, for us, it became a personal story, even for myself, now that I look at it, because now I've been treated in the same way. I sucked my thumb, I had, TMD issues, I had braces, but I was still off grinding my teeth, things that I was like, well, I'll just get over it, anxiety, all of that. And as a woman, we don't necessarily have sleep apnea outright.
We don't snore.
Yeah, we don't snore, right?
No, never.
We don't have our mouth open. We don't have any of that, right? We hold everything inside.
We're the last to go to bed, so no one can tell.
No one can tell, right?
Exactly.
So, all of those underlying nuanced type of, not even fully chronic diseases, but, right under there, those become compounding, and then all of a sudden something's happened and our body says no more, right? And it all starts in infancy or, even a little bit before that. Yeah. So that's how we started to, say, okay, we have to, let's take a pause, start looking at our children and start evaluating them much, much earlier.
Interesting. Yeah. And it's funny, you think of dentistry as just teeth. But that's not
precisely.
The case.
Yeah, the teeth are connected to something.
Are they?
Are they? Right?
Yes.
It was a while. I mean, it's still that way where parents are like, "Well, it's just baby teeth.
Right? It's gonna fall out.
It's gonna fall out. It's like
fell out.
Right. They forget all the other things that occurred around when the teeth fell out, or what their body was doing, and that it's organic material. So
Yeah. That's
true.
It's all part of the body.
So this is a complicated question. How do you fix it?
Oh, yes, it is very complicated. It is complex,
But
not
it's doable.
complicated.
Right.
It's
It's
doable.
complex,
It's
but
complex
doable.
and doable. And again, for us as a practice, based on our experience and a lot of training, mind you, I've been a dentist for over 30 years, and a pediatric dentist for over 20, actually 27. And so a lot has come into the practice, and generally where I train from home, you had to look at a whole person because you could be the only DI doctor in a 50-mile radius. So I've always looked at the body as a whole. And so for us, we're going to get a full assessment, get a comprehensive, it's almost like getting a blueprint so that you can now start building the house one step at a time, little by little, and collaborative because it's all connected. Although our licensure is from neck up is connected all the way to the feet. And then many people don't even know that the tongue is connected all the way to our feet. And that is the second organ that's formed by 4 weeks when you're pregnant. Even before you know you're pregnant, it's already moving. So it's a really important organ. Yes, it's a really important organ. I know.
I'll take your word for it.
That's nerve
No,
wrong.
it is. It is actually the truth. So when we do a comprehensive assessment, we're looking at it again from several pillars. It's not just a structure, which a lot of people do, and they say, oh, we're doing airway, but they're just really doing expansion. And it's not just about the size. It's how that size functions. Some people have a small size that is toned and functions well, but there are other things around it, and maybe the muscles around it don't function as well. So now putting stress on the airway. So we look at it from a structure, which is what does it look like? Function, how does it work? Behavior, what have they learned to compensate? How have they learned to use what they have that wasn't right? And nervous system, that's a biggie because what's the brain doing? For a lot of the children, they're always in a state of fight or flight. Everything is there, and that's because their nervous system has not been able to just download and get the parasympathetic, the rest and digest portion of it working. So that's one of the very critical things that we have to do is get the brain to settle down. It's almost like the kids are running around with a AAA battery when they needed a big D battery to operate. So you kind of get them down so you can now start increasing the resource that brain has to help them make those functions because every one of us have what we need when we're born. But what has made it not show up? Those are the restrictions that we're taking away for them so that they can show up as who they were meant to be. Mm-hmm. So that's the neurology. Then you talk about nutrition. What are they eating? What's eating them and what are they eating? And are they even absorbing the food that they're eating properly? And then you talk about the posture. Because most times when they can't breathe, most times when you're not breathing well, you almost kind of have to throw your body in different positions so that you can breathe better. And that's not good for long-term health. So, and then because we're going from neck up, we act as quarterbacks. Because who else is going to help to get the rest of the body so that we can work together and make that child to be their utmost best. Sometimes it's a cranial osteopathic physician, sometimes it's a pediatric or neurology versed chiropractor, sometimes it's a craniosacral therapist, sometimes it's even a massage therapist. So we look for, obviously the ENT, the tonsils not noise at such a state that you can't really work with it to see if they clear up, and sometimes they're allergists. So we work collaboratively with a lot of people. And speech pathologists as well. Mm-hmm. You hear some parents say, oh, my child's been in speech for 3 years. Yes. What is the reason this child has been in speech for 3 years? Yes. You got to ask that. Is it that they don't understand? or they can't do what you're asking them to do. So now it goes back to that tongue function again. And it's not necessarily a tongue tie. I know that's a big word out there,
Yes.
tongue ties. Yes. And it is tongue function. Sometimes it's a structural tie, but a lot of times if you don't digest and unfreeze the body so that the body can work like it should, you just go cutting willy-nilly.
Yes.
That's not going to get you where you need to be.
Wow. That was a loaded answer.
I know.
I thought you were going to say, here's
Right.
the formula after 30 years of experience. No.
Right, and that is actually
different.
yes, that's part
Parents
of it.
want to hear that.
Yes,
What's the
what's the fix?
Okay.
That's the unwinding that you have to do for the parents as well,
Yes.
because they themselves went through braces, everything, retainers, then another round of braces, then another round of braces, right? And then now they struggle with other things, and they're like, well, that was fine, that was okay, and you're okay to insofar as you're compensating for something else, right? So that's exactly what we tell parents. There's no fix. Each person within the same family is different. You have to tailor it to what you've seen in what we've seen in a diagnostic, right? And there's a process of unwinding and then exponentially getting better.
Yeah, you gotta get them to 0 before they can go up. So,
Well, this is a tricky question. What's the oldest pediatric age child that you have seen that you have been able to say, hey, I think we have an airway issue?
oh gosh, I've been doing this for a very long time, and I was doing early orthodontics, actually a long time, even before the orthodontists in the area started doing them. And at the time, it was just good enough to make room for them.
Yes.
And they had beautiful teeth, straight teeth. And when I started knowing more, I saw them. They had the straight teeth, but they still had bags under their eyes. And they were still having sleep issues, anxiety, and all of that. So essentially, my patients didn't leave the practice. They're still there. So I think the oldest one, this one might be 35. Wow. And he still comes. So now he brings
his
No,
pediatric.
I know. He just wouldn't go. He just wouldn't leave. He just wouldn't leave.
And we don't want them to leave. We take care of them.
Yeah. And most of them don't have cavities because we place sealants on their teeth when they came in. And so anyway, and I'm looking now and I'm going, we do that 3D CBCT, which is a 3D scan that goes from the head up to the neck, and we go, oh, look, your tongue is still looks like it's falling back. You don't have a whole lot of space. And, we did the questionnaires and start looking in, and we start finding they had a lot more of those issues. So, yeah, it starts from even before you're born, and you have to start thinking about it, because if mom's not breathing right, guess what? That baby is not. Baby's not breathing right either. So, yeah, I want to say.
Been able to take care of a patient.
Oh, yeah.
Yeah, in the 20s, late 20s.
Yeah.
And reduce AHI, which is that sleep apnea, hypopnea index. Which is what most people know.
Oh,
right?
most people know this.
They know, right? Oh, sorry. When they have obstructive sleep apnea, that's the measurement that's
the
they
measurement.
use for it. Yes.
It's not really a good measurement anyway, but that's the way what insurance will see as a measure. And don't get me started on insurance anyways, but that's for them. But then insurance is not your health, really. Right. So in their 20s, we can still help them. Really, so
that's awesome.
Yeah,
that makes my heart happy. You guys don't dismiss your patients. You're like, stay.
Oh yeah, and we'll become quarterbacks for them too if they have anything deeper, right? Like they need a root canal or something of the sorts. Then we're able to help quarterback to say, okay, you can see this person, and we'll help with this other thing, and we have things for them to be comfortable. So I mean, it's an intimate process. Going to the dentist. This is still my dentist, so.
That was my next question is, do you guys see each other? How does that work?
The oldest patient is my age. So, yes.
That's incredible.
Yeah.
Well, that's very heartwarming, and you guys taught me something.
Oh.
and I'm thinking of tongues flopping around, and I'm thinking of not swallowing my own tongue, if that's even possible. I'm
It's
very
attached.
body conscious right now.
Oh,
This is, you guys definitely know your stuff, and you taught me something today. I had no idea.
Yeah.
So now I'm going to be looking at my kids like, you have airway issues.
Yeah, you always, a lot of the kids walk around with their mouth open all the time. And that's not good because really the mouth's just for eating and speaking, and you should always be breathing through your nose. And again, it goes back again to tongue function, because your tongue is supposed to rest on the roof of your mouth. That's how your brain breathes. That's how your brain's able to eliminate waste products, because of the action of pumping action of the tongue to
Doctor,
the
do this
skull.
again. I'm going to crawl out of my skin.
this is why
Tongue needs to
when it's a
stop.
law.
Let's put the hypothetical tongue down.
We should have brought our stuff.
Actually,
I'm sorry.
No,
I didn't know that. That's
No,
interesting.
yeah. So many people don't know that, and so when even as babies, when you see their lips open, it's a good thing to gently close it for them, because the brain will need to learn how to breathe through the nose. So if your child is walking around with their mouth open, that's not healthy. That's a lot of those, and you get, they have allergies, they have tonsils, they have to get, why should a baby who's 2 years old need to have tonsils and adenoids out? They're body parts. They're not supposed to be taken out. That's part of us. So you have to ask why. And, by the time they're 6, 7 or so, and we see them take the CBCT, it's grown back. So because you did not take care of the root cause, what caused it to get that way in the first place?
Or crowded teeth.
Crowded teeth. Everybody's ready to go get braces, but why are your teeth crowded?
Yes.
Because if your tongue moved well, you would make room. If you chewed well when you were young, your jaws will grow. If diet is different, our faces are smaller than what they used to be, but still, you should have to then help them get the good foundation first, then think about teeth later on. Really. So.
Well, thank you so much for your expertise in the tongue talks today.
They're going to be thinking about the tongue.
I'm telling you, I'm going to go home and I'm just going to think of a tongue with 2 eyes. I'm
It
kidding.
is a lot.
It's definitely, it's
Yes.
impressive that you guys are able to do this and be so professional about it and really just enjoy it.
Yeah.
And think that this is phenomenal. And, as a parent, now I'm thinking differently. I'm like, maybe we should, I don't know, all get tested. Now you're thinking maybe it's not a bad idea.
That we changed our entire practice.
Yeah.
I mean, every child gets screened,
Yeah.
and the miracles that we're seeing after we are starting to treat our patients, even at the old age of 27, so to speak, right?
Yeah.
The teenagers, they're running, they're being more athletic. You can see their faces light up.
The endurance is better. And for me, it's usually once they start getting, when in treatment, they start getting better, under their eyes, which used to be dark, becomes the same color as their cheekbones. I just start grinning from ear to ear, because that tells me that child is getting good sleep at night. And when a child is getting good sleep at night, they're more able to function.
Yes.
They're more able to be who they're meant to be. And for a lot of them, they're disruptive in class. And they get, you got ADD, ADHD. And no one's really checking to see the quality of their sleep or how their jaws have been growing. And so for a parent, if you have been asked to put your child on medication for ADD, ADHD, you want to ask for a sleep study first. Ask somebody to check their sleep for you. Or if you know somebody who's knowledgeable about craniofacial growth, that means the growth of the jaws and the face, have them take a look for you to make sure that tongue is functioning well and their jaws have grown well. The baby teeth are supposed to come like picket fences on them. If you don't see spaces between your child's baby teeth, there's a problem.
Interesting.
And you may not know what it is, because a lot of the signs are so common, people think they're normal. But they're just ways that the body is trying to tell us something. This is not right. Help me fix this. And the sooner the better, it's never too late.
That I wish we could put that on a billboard. If your child has been diagnosed with ADHD, stop. Let's talk.
Yeah, there's actually a study from it's from Karen Bunnock. If they Google Karen Bunnock on the YouTube, Dr. Karen Bunnock, they'll be able to see it. They'll be able to see that study. The signs are the same. They mimic lack of sleep and AD. They kind of mimic each other. And by the way, there's not a blood test that you do that says you're ADD, ADHD. You got to answer questions.
Yes, yes.
So,
And most adults will say,
yeah,
Right.
Yeah,
You won't.
And most people will just go and take a pill for it, and that pill changes their brain chemistry. So, as a parent, I would be asking more questions.
Yes.
If I get that kind of diagnosis or someone tells me that, and explore other options first before you change your child's brain chemistry, because then they start on that. As they're getting older, they're getting more anxious, more other symptoms that didn't treat to start. Then you add more medicine, and God forbid, they now get off your insurance. Now they have to go find the drugs themselves that will help them feel okay.
cause problems now.
Yes.
Compounded.
Yes.
That's a conversation for another day, but that's incredible.
Yeah.
But I agree with you. Sleep, I mean, just from a common parent perspective, we always say sleep is supposed to rejuvenate and help you grow.
Yeah.
And if it doesn't, then we have a problem.
Yes, that is true.
And for kids, that's where the growth
critical.
hormones are made. So it's extremely critical. They're not growing tall,
That's
things
it.
like that. So
First 1,000 days, that's the most important time of their brain growth. They have all these neurons that are just waiting to soak up knowledge. And if they're not getting good sleep, what kind of brain are you forming?
It's very true. Well, thank you guys so much for coming, Mama Duru and Baby Not So Baby. But this has been an amazing conversation.
Wow.
Your patients are very, very lucky
Wow.
to be able to have you explain these things to them.
Wow.
And I just wish there was, like I said, a microphone or a billboard that people could hear this, because so many parents are being bombarded with, well, your child might have ADHD, or your child might have this problem and that problem. Let's reel it back to something more fundamental than that.
Absolutely, absolutely. And
because
as we were coming in this afternoon, I was just looking back and thinking how long it's been when I came to Loudoun County. I came out here in about 1997, so worked in a practice in Sterling, and then in 2000 opened my own practice in Ashburn. And I just want to say thank you. The community has been so welcoming and so loving, and we've done our best to do our part. We've continued to educate ourselves. We brought lasers in so that kids could, if they had a cavity, we could treat them without having to put Novocaine in them. And now we got the CBCT scan so we can help them learn the way their children are growing. We're continuing to learn. It's not easy because not many providers want to go out there and learn more.
No.
And it's almost like for me, it was like going back to school.
Yes.
It actually costs more than the education of going to dental school. But we're happy to do it because when we see the children, it's so heartwarming to see a 2-year-old. The mom tells us, we were at the grocery store and he said, don't buy that food. Only because they had a hands-on learning in the practice. We have another kid who's at MIT who's pursuing biochemical PhD in biochemical engineering, and he said it was coming for your practice that made me get more interested in science. Yes. So when we hear stories like that, and then most importantly, having the kids now learning to breathe through their nose and walking in when they used to come in with their head down and just looking dead. It's 9 o'clock in the morning, and now just coming in, no more dark circles under their eyes. They're more expressive. We can't shut them up anymore. You just know you're bringing out the best in them. And so for all those parents and all those patients, we're just very grateful. And I don't know how else to say it, but thank you, Natasha, because this is an opportunity for us to say thank you. The community that has supported us, and we keep wanting to support. We're gonna keep learning for them, and I can't do it any different because now she's here. I can't leave a mess for her. I can't leave a mess for her. She won't let me hear the last of it. But anyway, so we just want to say thank you.
Well, thank you for spending time with me, and thank you for doing this podcast.
Well, thank you.
It was fun.
It is fun.
I hope it was informative.
I definitely learned a lot.
Well,
100%. Now I'm going to watch my own kids. Something's not right with you. I'm kidding.
That's all right.
That's what
It's
happens
okay.
to a lot of
That's
parents.
I'm
now.
sure.
After
Probably
they
call you. My kid's acting up. I think we need a consult.
Yeah.
Yeah, we get those too. We get those, and the symptoms that the problems are usually the same, but the symptoms are different
for
for every kid, because your body learns a different way to survive. But why would you want your child just to survive? They need to thrive. And parents of nowadays, especially in this area where God has blessed you with the means to be able to seek out the best for your children. Yeah. Getting the knowledge. The knowledge is out there. If it's not us, find somebody else. But help your child. Don't let your child have to go through at least what I went through. But I know if my parents knew, they would have done it. But they didn't know. And nowadays, it's not an option. If you come to our practice, whether you want to hear it or not, you will hear it. Because that child is depending on us to tell you what's best for them. You're going to make the decision, but you're definitely going to get the information to make the best decision that you think for your own child. So that's my legacy.
Mic drop.
I know, right?
If you enjoyed today's episode, be sure to follow and share this podcast with a friend in dentistry. And if you're ready to take the next step in your own entrepreneurial journey, connect with me. I'd love to make your vision a reality. Until next time, keep building, keep growing, and keep practicing your passion.